Today I'm going to talk about a subject that affects a large number of college students, the abuse of the prescription drug Adderall. Adderall is also known around college campuses as Go Pills, Study Buddies, and the Smart Drug. In a study done by the National Survey on Drug Use and Health, the majority of the people taking the prescription drug Adderall are full-time college students between the ages of 18 and 22, being more prominent within the age groups of 21 and 22. In another survey study of students at 119 American college campuses, published in the journal Addiction, it was found that up to 25% of those enrolled at a very competitive university had used Adderall as a study aid or abused it at one time or another. Short-term Adderall abuse can lead to loss of appetite, high blood pressure, chronic headaches, sleeping disorders, and mood swings. The long-term effects of Adderall abuse can include severe withdrawals, periods of severe depression, and even amphetamine psychosis. Adderall is known around college campuses for being able to help students stay up and study later, get better grades on exams, take less time to write papers, and overall give them a competitive edge when it comes to academics. But have you ever actually thought about the effects that Adderall is having on your brain? In this picture, there are two brains. The brain on the left shows the increased activity caused by the drug Adderall, while the brain on the right shows normal brain activity. I'm sure you've all seen the this is your brain on drugs commercial when you were growing up. To me, the picture that I just looked at reminds me of that. After all, Adderall is an amphetamine. Much like methamphetamine, meth, cocaine, drugs like that all have similar effects to your brain, just like Adderall does. Not only does Adderall have harmful effects on your brain like other amphetamines, it also poses the threat of addiction. When you abuse any type of prescription pill that is not prescribed to you, there is always the threat of addiction. According to the U.S. Science Review, Adderall is a Schedule II drug and has a high risk for dependence and addiction. It is hypothesized that the addictive characteristics of Adderall are due to the activation of the mesolimbic dopaminergic pathway in which the amphetamine in the drug binds to the transporter of the neurotransmitter dopamine to prevent removal of dopamine from the synaptic cleft. By prolonging the presence of dopamine in the synapse, amphetamine produces the long-lasting side effects of euphoria, pleasure, and concentration, all which can lead to addiction. Since 1993, the amount of Adderall prescriptions has more than tripled due to the increasing amount of popularity among college students. Adderall comes in many shapes, sizes, and colors and ranges anywhere from 2 milligrams to 30 milligrams. Originally, Adderall was prescribed for the use of treating ADHD. The thing that scares me the most about Adderall abuse is the fact that we are increasing the amount we are feeding to our youth. The average increase of ADHD diagnosis has gone up nearly 6%, and the increase in the percentage of children receiving this medication steadily increases as well. Can we truly justify giving an amphetamine to a young boy or girl, especially when it may later cause psychosis? Are we over-medicating our youth so much that it's carrying on to their college study habits? If you or anybody else you know has an Adderall addiction, please contact your counselor at your local university. They can help you.